Okay, thanks. What we would like to present today is a study that recently Sivia and I conducted, and what we wanted to do, or what we want to examine, was to see how relatives influence the medical decision-making process in genetics, in genetic counseling, and specifically how it affects patient autonomy, which is perhaps the most important bioethical principle in Western bioethics. So what we know, because we talked with geneticists and genetic counselors, that relatives do accompany patients to genetic consultations. And what we also know is that genetic test results do have an impact on, or may have an impact on the personal health of relatives. So what we ask is, does this combination change or make an influence on the role and status of relatives during genetic consultations and before and after these consultations? And again, what we also want to focus on is how does it affect patient autonomy and his or her relationship with his physicians. So before we start, although I appreciate that most of you are familiar with the concept of patient autonomy, just to to be clear that today in bioethics we talk about two main conceptions or approaches to patient autonomy. The conventional or traditional perception, which is more individualistic, which talks about the wish or the belief that the individual should make a decision without relying on the judgment and the will of others, or with minimal involvement of others in his or her decision. And gradually, in recent maybe the last 2 decades, a relation approach become much more prominent, appreciating that people or the individual makes decision in a social context. So although he or she must have a private sphere where he or she can consider her options privately without the involvement of others, still in most of our life decisions, we do make decisions in social context, whereas we take into consideration the interest of others, and the interests of others do influence our decisions. So in light of this introduction, what Sivia and we made a few assumptions regarding our study. So we assume that the presence of relatives in genetic consultation do affect the decision-making process. We thought that, we assume that the presence of relatives do challenge the conventional perception of patient autonomy, and that it challenges the perception of the doctor-patient relationship, because we assume that relatives have an inherent role in the decision-making process. And we also assume that physicians and also the patients do adopt in practice a relational rather than individualistic perception of patient autonomy. Okay. You want me to? Okay. So just before Sivia will take over to present the aims of the study, so we wanted to examine, as you can see, the clinician's views and perception about the relatives' presence in consultation and their involvement in the decision-making process, how they influence the consultations, and how they influence the ability of patients to make autonomous decisions. So, Sivia, please.
So, I'll present the research and the results. This was a qualitative study using semi-structured face-to-face interviews with clinicians who work in the area of inherited breast cancer. Interviews took place in 6 medical centers across Israel. Altogether, we had 28 participants, consisting of genetic counselors and geneticists, physicians, nurses, and a social worker. And that data was analyzed using the framework approach. The consultations around cancer diagnosis and testing consists of at least two meetings, one before testing and one after. In the first meeting, the clinician discussed the risks, the benefits, disadvantages, and the implication of undergoing testing and available preventive measures. In the second meeting, the test results are provided, and if the patient is a carrier, the implication of the results and available treatment are discussed. So we divided the results for the first consultation and the second consultation. So patients bring relatives to consultations in order to have support, informational and emotional support. And many times during this meeting, the patient realizes that they are potential patients, and this changed the dynamics and their role in the meeting room. In the bubbles, there are some quotations, and I'll read some of them. This is a quotation of one of the genetic counselors. There are situations where people come as companions to the consultation, and suddenly they discover that they are patients and that the information is relevant to them. Naturally, clinicians involve the intending relatives because if they're there, they many times want to be involved. And some clinicians address the patient relatives also as as one of the counselees, even though that the patient is the one that was referred. Clinicians explicitly express positive attitudes towards the presence of relatives, with mentioning advantages and disadvantages. The advantages are providing support to the counselee, to the patient. The disadvantages are sometimes there is imbalanced power between them when sometimes their relative becomes the dominant in the room. Like one clinician said, sometimes the companion takes over the conversation. In this context, our professional skill is to identify this, to allow it to a certain extent, but also to continue the consultation in a pleasant environment. The clinicians highlighted the independence of the patient to make autonomous decisions in light of the pressure of relatives put on them. Many times the patient's relatives try to influence the patient's decision. And the clinicians feel responsible to make sure that the patients will be the ones to make the decisions. So they have two means of keeping the patient's autonomy were identified. One is being very assertive with relatives, and the other is sometimes to delicately ask them to leave the consultation room. As one quotation is, if I see that they disturb one another, usually the mother causes stress to the daughter, when I see it is unreasonable and disproportional, I say, please give us a few minutes alone. And this way they preserve the patient's autonomy. Many times what the clinicians see that siblings want to go through the whole process together. They try to separate them, but many times they insist on having going through the whole process together. And then what the clinicians described was influence of one sibling on another, and they also have many times different views of the means they need to take, if to be tested or not. So many times they don't succeed in separating the siblings from the process of the diagnosis. What the clinicians described is the parents try many times to prevent the young daughters from undergoing testing. Many times they try to protect them. But what was evident that despite the parents' explicit attempts to prevent the testing, eventually the patients do undergo the testing. And this is one quotation. I had a family where the father was a carrier and he had 3 daughters. 2 decided not to undergo testing, and the third, age 18, decided she would undergo testing. And there was a discussion here between the father, who said, "Why do you need to go to do it?" The daughter said, "I want to do it. Information is power." The father told her, "You have all your life ahead of you. Why do you need to do it now?" So, as we see that the patient comes with relatives. The relatives see the relevant of the information to themselves, and they many times try to influence the decision. But the clinicians try to maintain the patient's autonomy. In the second consultation, which is post-testing, relatives usually take a role of supporting the patient, and they usually allow the patient to make their own decisions but supporting them. And at this consultation, mostly the spouse is the companion. And clinicians felt that when we're talking about oophorectomy, that there's no role, the relative do not interfere, but mainly because this procedure is recommended and is kind of standard of care to recommend to do this procedure once the fertility plans are ended. But they felt that the relative have influence on the decision to undergo preventive mastectomy, and many times they're very in favor, and they try to encourage their wives or spouses to undergo this procedure, probably because they don't want them to get sick, and they want them to stay alive with them. And clinicians' view is that the patient personal autonomy is highly important at this stage when decisions about preventive operations are made. But they state that the involvement of the family is also important. And the last quotation is, "I think that when the patient decides to undergo mastectomy or not, she thinks about what her partner would say." So this is actually, we try to maintain the patient's autonomy, but it's actually a couple or both spouses are involved in this decision. And the discussion, we will go on.
Okay, thanks. So what we saw in our study is that the presence of relatives do have an impact on genetic consultations. As we saw, the presence do affect the decision to undergo testing, less so about having preventative operations after testing in the second consultation. But I think what was one of the main finding in our study was that relatives in genetics do become potential patients or even patients themselves during the consultation. So they come as relatives, as people just to support the patient, but during the consultation itself, they become aware of their personal risk and the fact that they can make some decisions regarding their own personal health, and it does have an impact on the consultation, primarily before testing. As we saw, after testing, it becomes a more standard or conventional model of doctor-patient relationship with their relatives as companions. I think since this is a medical law conference and bioethical conference, so to talk about, again, about patient autonomy, our assumptions was quite confirmed in this study. So we saw that the conventional bioethical approach to autonomy, the individualistic perspective, is less influential in a sense that decisions do or are made in a social context, in a sense that relatives do have an impact on the decision that patients make. So we thought that it is recommended to adopt a relational approach, which should include the 3 parties. So this does have an impact not just on the bioethical literature and discourse, but in a legal sense, I think that we think that the law should adopt such an approach. And thank you very much.